This is as close to pre-ACA as what we can find on the market today. If you notice here, we have a $1 million annual max, which is what we had prior to the ACA, except we had a $2 million lifetime before, and now we have a $5 million on this plan. We can pick lower options to save on premium dollars, but the option is available for that $1 million. They offer 3 different levels of coverage. We typically recommend the plus or the preferred plan. They also offer deductible options ranging from $100 all the way up to $10,000. Now on this plan, you can safely pick a higher deductible option. We find the sweet spot is one of these 2 right here, because on this plan, it does not charge you a deductible unless you were actually admitted to the hospital. Now on the higher deductible plans, they also give you an added benefit in the form of a first day admission rider. And this resets every single calendar year with your deductible, so it is not a one and done and is per person on the plan. So for example, if you were admitted on the $5,000 deductible plan, which is an option that a lot of clients pick, they're going to give you $2,000. Now, you could use this for whatever you want to, but assuming you applied it back towards your deductible, you can see that we can make this a $3,000 deductible plan. We also have the added option of adding things like critical illness riders and accident plans that would further reduce our deductible for pennies on the dollar versus picking a lower deductible plan. Now on this plan, you will notice that the deductible only applies in the areas of these check marks, either confinement in a hospital for over 24 hours or more, or confinement in an ICU. That's the only time we would ever have a deductible. Even when we go down here to surgical benefits and things like that, you notice there is no check mark, no deductible. That's important because most people's first bad experience with insurance is when they have to have a relatively minor surgery, their gallbladder taken out, maybe they have to have their tonsils taken out, and they find that they end up spending $5,000, $10,000, even $15,000 out of pocket for a relatively minor surgery where they walk out of the hospital the same day. On this plan, you'll notice the outline of coverage looks different than what you've seen before, because on other outlines of coverage, they're only going to tell you what you pay first, and they never tell you what they pay. That makes it very difficult to be proactive in your healthcare. You can see things like this where they say per day. So on a nursing home, for example, where a lot of major medical plans, at least in Texas where this is being filmed, they may limit you to 25 days in a nursing home. This plan is going to pay for you to be in the nursing home every single day. That makes it even better at much lower cost than what's available out there. Again, this is one of the most benefit-rich plans on the market today. Surgical benefits are what led me personally to this plan, because I had some bad experiences, just like many of you may have, with paying a max out-of-pocket, surgical copays, and on some plans, your deductible on top of that. This plan is going to pay per procedure, and the way they do it is the reference-based relative value scale. This is a Medicare multiplier. Now, a lot of PPO plans, true PPOs that use this system, which has been around for about 10 years, they will only pay anywhere from 125% to 150% of Medicare rates. On our plans, we're going to pay 200% of Medicare rates on the plus plan, or 300% of Medicare rates on the preferred plan. Now, the cool thing about reference-based pricing is it travels with you across state lines. If you drive a truck, you like to travel, this plan is going to travel with you coast to coast, and it's going to pay the reference-based pricing for that area. So if you're in California, and costs are a little bit higher. If you're in Arkansas, costs are a little bit lower. It's going to pay exactly what it needs to with no deductible and no max out of pocket in order to ensure that you have the most benefit-rich plan available to you and avoid the catastrophic balance spills. On your day-to-day coverage, we're not going to do things like charge you a copay. This is going to be first dollar coverage on virtually all benefits. Even on the admission where you did have a deductible, if you notice, you did have some sort of first dollar coverage in the form of your first day admission rider. Now, most people live in this day-to-day area right here. They go to the doctor, they pay a $30 to $50 copay, so you're paying first. And what copay really means is that you have to pay this amount. They're dictating that for you, and you have to pay that before they'll pay anything. Now, typically what will happen in a very common set of circumstances is that you pay that copay, but that's not all you pay. What ends up happening is you still end up getting balance billed. If your plan does not pay what the provider wants, you could still pay more. On this plan, instead of you paying first and then them negotiating on their behalf, The insurance company is going to pay first. They're going to give you 20 office visits per person on the plan with no specialists, of course, charge more, so they're going to pay more. A surgeon would charge more, so they're going to pay more. And this would include things like small minor procedures in an office. On things like an MRI, PET scan, CAT scan, nuclear testing, you're not going to be subject to your deductible. They're going to pay first dollar coverage. Now, what's very, very cool, you're seeing that they're telling you that they'll pay up to $500 after network negotiations. That allows you to use this plan as a hybrid. You can slap down your card like a traditional PPO, and you can let the network do its thing and just see what happens. Or you can be very proactive in your healthcare. It's not uncommon to go into a facility and find out that an MRI is they're going to charge insurance between $1,200 and $1,700. They'll normally tell you that the cash price might be $375 to $500. Now, on this plan, we don't have to throw our money down the drain. If you want to pay that $375, you should, because guess what? We can use this as an indemnity as well, submit the claim, and they will pay us 100% of what they would have paid had the provider filed that claim on your behalf. You can use it both ways. Again, it's about being very proactive in your healthcare and protecting yourself from those catastrophic balance bills. No more do you have to pay a super high premium only to turn around and pay the first few $1,000s every single year of your own healthcare costs. As you can see, we're covering all of the things that you would see on a typical plan, your x-rays, other diagnostics. This would be things like EKGs, ultrasounds, things of that nature. We're going to be paying for labs, injections, emergency department. Instead of charging you $500 to $950 to walk through the door, which is the typical emergency department copay, we're not going to charge you anything to walk through the door. In fact, we're paying the first $600 for you to walk through the door, and then we're going to pay per procedure. It is the best paying plan on emergency room visits on the market today. Urgent care is where most plans are going to point you in the form of a relatively high copay, because it is way more effective on the healthcare system for you to go to urgent cares. But rather than charging you a high copay and then not telling you that that copay doesn't include things like x-rays and things like that, which is what the typical plan is going to do, we're going to give you a very robust benefit of $300. Now, I do want to tell you that if COVID is a concern, all of these benefits are going to be doubled. And I'm only focusing on the plus plan. Sounds phenomenal, but the preferred plan, as you can see, is going to cover you even better. Now, the cool thing about this plan is that any time that there's a surplus, it comes to you. It's not about getting rich, but if you take your child to the urgent care and you pay $80, they don't care. They're going to pay $300 for that visit to somebody. So what happens there is they pay your provider exactly what they asked, and you get the difference. It's not about being rich. You're not going to be a millionaire on this plan. It is about being very proactive in your healthcare. This plan is one of two on the private side that actually covers prescriptions. It is one of two on the private side that is a forever plan, meaning that most of them are going to be annually renewable. This plan, once you're on the plan, they can never drop you except for non-payment of premium. Adults can stay on until they're 20 or till they're 65. Kids can stay on until they're 26. We can even put kids on here by themselves if they're costing you a fortune to be on your employer-sponsored plan, from as little as 30 days old. This plan is the only plan on the private side that is going to provide you with the same minimum essential coverage wellness benefits that the ACA covers, but with an added bonus. On this plan, there are no age restrictions for things like mammograms and colonoscopies. Mammograms, if you're 20 years old, ladies, you can go and get a mammogram on this plan. Very, very cool. We can, again, add things like the critical illness riders and or the accident riders. We can do anywhere from $10,000 to $50,000, and this is a lump sum upon initial diagnosis. And then some additional value adds that we add to all of our plans is we can do things like free teledoc. Teledoc is available. It's a network of 20,000 board-certified physicians. This is available to you free of charge, 24/7, 365. You are going to be in the PHCS PPO network. No longer do you have to get into those HMOs and not be able to find your provider in network. On this plan, it doesn't matter where you go, the plan is going to pay. PHCS networks, all they really are is pre-negotiated pricing. So you want a large network in your favor. This encompasses 98%, stands for private healthcare solutions. 98%, there's literally 2 carriers on the private side that are outside of this network. Huge conglomerate network, best negotiating power that I've seen in my experience. And then the very last thing, if you've ever been the victim of a catastrophic balance bill, which I have, I can tell you that it is very overwhelming. It's very daunting when you have no advocacy. On this plan, even after the network is negotiated and the plan is paid, if you ever receive a bill or aggregate of bills for a service that exceed $2,500, we can submit those bills to CARES, and CARES will aggressively negotiate those bills down on your behalf. They have a vested interest in doing so because they actually make a commission off of every dollar that they save you. I encourage you, go to CARES 360's website or visit the CARES group on YouTube, and you will find stories of them saving clients hundreds of thousands of dollars. Again, this plan ends up being around 40 to 60% less than even the worst performing plan on the ACA. It typically, on average, is about 20+% less than other private plans on the market. If you've ever been disqualified for a private plan, we find that they have much more liberal underwriting on this plan. So you may be surprised where other plans will exclude you if you have high blood pressure or things like that. They want to offer you coverage. They're changing healthcare as we know it today.